Hello, everyone, and welcome to today's session, Your Mental Health Matters, Recognizing Your Needs and Finding Supports. Thank you for joining us, and I hope you had a good break or were able to check out some of the expos. My name is Ryan Woolley, and I am the Senior Director of Public Education here at the American Kidney Fund, and I'll be your moderator for today's session. Today's session is especially important because transitioning from in-center dialysis to home dialysis can be a big change, not just for your daily routine, but also for your mental and emotional health. Many people tell us that while they really value the independence and control that come with doing dialysis at home, it can also bring new feelings like loneliness, stress, or worry about managing treatments on your own. And that's when having the right support can make such a difference. And it's so important to talk about caring for your mind as well as your body. So today you'll hear from two speakers, Lupita Ayala, who will share her personal journey with home dialysis, and Luckman Adebayo, a social worker who will experience supporting patients and families through these changes. Lupita is a kidney transplant recipient and a former home hemodialysis patient who uses her personal journey to advocate for chronic illness and mental health support. She shares her experience to empower others to navigate dialysis, transplant, recovery, and mental health. Thanks for being here, Lupita. And Luckman is the manager of strategic social work services at Fresenius Medical Care. He leads a team of dedicated social workers in dialysis clinics, ensuring patients and families receive the care, resources, and encouragement they need for a better quality of life. Thanks for being here.
Thank you, Ryan.
Before we get started, I want to let our attendees know that we will have a Q&A towards the end of the session, so drop in your questions in the chat box anytime, and we'll do our best to answer as many as we can later on. And I'll start with Lupita. So Lupita, thank you for being here. Could you start by telling us a little bit about your journey from in-center dialysis to home dialysis and how that change affected your daily life and your emotional health?
Yes, thank you, Ryan, for having me. So I will start with, I started dialysis November 1st of 2021, being the first person in my family to ever have kidney disease or even have to start dialysis was something hard for me mentally, because I didn't know what to expect. I didn't know what was going to happen, if there was a cure, if there wasn't a cure, what I needed to do to be okay. So I went into this journey kind of blindfolded. When I went into that dialysis center, I remember feeling lonely, scared, mostly scared, but I decided I was going to try my best to be okay, because I had just gotten married. I had my whole life in front of me, and I was determined to not let this disease bring me down. Little did I know, in-center dialysis was not going to be as friendly as I thought it was going to be. I went through a lot of complications and suffered a lot of the side effects that a lot of dialysis patients suffer. It got to the point where I was in a really big depression episode, and it got to the point where I wanted to stop dialysis completely. I talked to my doctor. I let him know that I didn't want to do dialysis anymore, because the person sitting in that chair was not me. It was somebody completely different. I wasn't able to do anything of the stuff that I used to love to do. So I didn't want to do it anymore. Luckily, I had a doctor who is amazing. He advocated for me, he believed in me, and he pushed me into home dialysis. This was a scary journey for me because I would have to do it alone. Like I said, I was just married. My husband worked out of state. So most of the days during the week, I was alone. I had family near me, but all of my sisters and brothers, had small kids, and I didn't want to take time from their kids to care for me. So I would have to do this alone. I'd have to learn how to put my needles in alone, something that I thought I was not going to be able to do. So mentally, it was hard, very, very hard to wrap my head around taking control of my health. But once again, I said, if a doctor is believing in me and he's pushing me to do it, that means I can do it. So I went ahead and did it. We did the training. And 2 days after starting the training, I felt the difference. I felt the energy boost. I felt not having all those complications during treatment and feeling great. Um, Slowly, my depression started to go away, or I thought it was going away. And I finally went home. A month later, I was in California traveling, walking in Sequoia Park, being at my niece's 15th birthday party, living a normal life. So at that time, my mental health was perfect. It was at the best. I felt great. I didn't feel any anxiety. I didn't feel any depression or stress. I felt fine. But I've always said depression is kind of like chronic kidney disease. It is quiet and silent until it's not. So after being at home, I started working to be on the transplant list. I used to weigh 320 pounds. I had to lose at least 120 to be eligible for the transplant list. So I went through a bariatric surgery. I've had numerous surgeries and complications with that. And that was another thing that contributed to my mental health. Um, and, luckily we got through all of it. We finally got on the list. And even though I was on the right track, my mind in the background was saying, you're not doing enough. You're not where you're supposed to be. You're not okay. And the fact that I was here alone at my house made it worse. I felt lonely. I felt like I was alone on this journey, even though I had my husband on my side, even though I had my family near me. My sister lives right next door. Physically, everybody was here for me, but emotionally, my brain was telling me I was alone. And coming from a Hispanic family, mental health is something that's not really talked about in our community. So the fact that the topic of going to therapy even came up was something that I could not talk about, because in the Hispanic community, that is something that is a no-no, per se. But after so many complications and so many days of just sitting there crying, not knowing what to do, I finally decided, you know what? Therapy is not bad. I need help. I need someone to be here for me and listen to me. And I have to go to therapy. I started going to therapy, and that helped me. That helped me work through all of my issues, work out trauma that I've had from my past that I didn't even know I had, and helped me through my PTSD from starting dialysis and feeling all of this stuff. It was hard. I was actually diagnosed with chronic depression and chronic anxiety. So I had to go on medication. I had to go to weekly therapy sessions and once a month with the psychologist. It was just another condition to add to all of my health issues that I already had. But therapy was a good thing. It helped me find my coping mechanisms to help me feel that not so lonely, and feel that I was doing and was on the right track to my end goal, which was transplant. Even after I started therapy, there were days and times where depression took over, but I learned that's normal. We as dialysis patients go through a lot, and we don't have a normal life. We aren't normal. We're special. And it's normal not to feel okay every single day. We are strong just by living, just by being here. And that was something that I was not comprehending at the beginning. So it was a really big journey mentally to make that switch. It was a positive, but it also had its negatives. But like I said, luckily I was able to find a mental health team that understood me and that had background working with chronic illness patients and helped me get through my depression and my anxiety to have control over it.
Thank you so much for sharing and for being so open with our audience. And I'm sure there are others that can relate to your experience. And like you said, you are so strong for going through that and recognizing that you needed help and seeking that out. So that's great to hear. If someone is just starting home dialysis, what advice would you give to them to help them care for their own mental health?
You're not alone. You have a team of doctors who are taking care of your illness, your kidney illness. Just like that, you also have your social worker who is there to help you through all of this time, through all these difficult issues, because this is a life-changing event. Dialysis is a life-changing event, so you're not alone. You have your team. Find people that are going through the same thing you are, that are feeling the same way you are, and talk to each other. Find that connection with somebody, whether it be in person or on social media. But you are not alone. Just know that.
Yeah, that's a great message. Thank you. And could you also share, in addition to seeking out therapy, were there any other ways that you were able to cope or have recommendations for how others might be able to cope?
Yes. So I took up social media. That was one of the big things that helped me get through it, because I started sharing my journey on TikTok, and I found so many people that were the same, that were feeling the same, and that felt the same way about therapy. And being able to call them and talk to them, I've made so many friends that are in different states that I don't know in person, but I have their phone number and I call them daily or text them daily, and have those conversations when we're both feeling down. So finding those people that can, I guess, have that in common with you and know how you're feeling, that really helped.
That's great. So great that even from your home, you can find people going through the same exact experience and be able to connect and feel supported in that way. Thank you so much for sharing. I'm sure many people joining here today can relate, and hope that others can also feel less alone. Before we hear from our next speaker, I want to remind everyone to drop their questions in the chat and at any time, and we'll try to answer as many as we can during the Q&A segment towards the end of our session. So next up, we'll hear from Luckman, who again is a social worker who works closely with patients and families living with kidney disease. Some people may not know exactly what a social worker does or how they can help as part of a care team. So Luckman, could you start by sharing what role the social worker plays and how they can help support patients with home dialysis?
Thank you, Ryan. As social workers, we're we're a key part of the interdisciplinary team, and social workers play a role in supporting the patient as a whole, as against just looking at the medical diagnosis. For patients on home dialysis, that means helping them navigate the emotional, social, and practical challenges that come with managing treatment at home. We're providing therapeutic and counseling services, helping them with coping strategies. Also, we understand that they're not doing this alone, and we're providing services and support for even the caregivers as well, while also connecting them to mental health resources as whenever they are needed. We're also identifying stresses that may impact their adherence or also the quality of life, and to work with them to be able to create a plan that keeps the patient well supported. Thank you.
Thank you for sharing. There's a lot of big role that you play so supporting people. From your perspective and experience, what are some common emotional challenges people face when transitioning to home dialysis?
Transitioning to home dialysis is quite big. It's a really big step for every patient. It's one of the things that we encourage. While there is the autonomy of being able to do dialysis at home, but it's also normal for patients to have a mixed feelings, right? Where they're feeling empowered, feeling like I can do this by myself, and it also comes with that anxiety of the worries about being able to handle the equipment. Will I be able to take care of infections and so many other things, right? So these other struggles also comes with the lifestyle adjustment, right? Dialysis becomes part of the home. It becomes part of the daily routine as against being able to go to a center where you're removed from it. But you're working in the home, the machines are there, you're able to see it. It becomes part of the daily routine of the individual. So some patients may feel more isolated without the social support of the clinic. And also, these emotions are very common. It's part of our role to be able to help patients recognize this, normalize in the sense of letting them understand that you're not alone with this feeling. This is something that is very common. And with identifying, is also working together with the patients to be able to find a solution.
Great. Thank you for sharing. In what ways can patients sort of check in with themselves to notice if they might need support?
Yeah. One of the very key ways that we always advise our patients is to create kind of like a small daily check-in routine, right? Asking yourself, how's my mood today? How do I feel, right? Am I feeling overwhelmed? Do I feel like this is a lot today? Am I avoiding anything related to my treatment, right? Are there any changes that I'm noticing? Any changes in my appetite? Any changes in my sleep, my energy, or my mood? Can all being able to identify these feelings and emotions early can help know that, okay, I may need an additional support, which now directs me, depending on what I'm identifying, helps me go through who am I going to be reaching out to.
Great things to be thinking about, and agree with thinking about it early. It's definitely not easy to recognize when you need support, but good to check in with yourself. Where can patients turn to for support, both within their care team and in their community? And do you have resources or programs that you would encourage them to know about?
Yes, some of the resources are going to be shared in the chats for people to be able to see. You can click on links there. You can find some copies there. And one thing we always talk about is, patients are going home. They now begin to feel alone. We want the patients to understand and know that you're never alone in this process, right? You have the dietitians in the clinics. You have the social workers, the doctors were always there to be able to support. Your care team is always there. They're the first line of support when it comes to your care, right? Outside of the clinic, patients can also access community mental health services. They're faith-based organizations who provide certain supports. There are also peer groups, even on social media, just like Lupita had shared, on TikTok, Facebook, there are groups on there that one can share. And that's the sense of community that may be missing when a person is not in the clinic, right? We also encourage patients to be able to also be aware of national resources like the 988 Suicide and Crisis Lifeline, the National Kidney Foundation's patient support programs, and even the AKF and the AAKP pair groups. There are also services provided by the ESRD network themselves, and also speaking with the social worker in the clinics also helps because they have resources that are geared towards your locality.
Awesome. Great, thank you. And yes, be sure to check out all the resources shared in the chat for additional avenues of support. Thank you so much for your expertise, Luckman. It's great to know there are so many people ready to help and resource programs available for support. All right, so now we'll open it up to our Q&A portion of the session here. So as a reminder, type your questions into the chat box and we'll try to answer as many as possible. You've already started getting some in. So to start off, first question here, how does one seek help if one is so depressed there is no energy? They feel fatigued from the disease. And I'll pass it, Lupita, to you first, and maybe Luckman, you can also weigh in.
So I think the easiest way, you don't have to go out and look for a therapist on your own. Talk to your social worker, mention that you need to talk to somebody, that you're not feeling okay. Your social worker is going to be the easiest way to go and find, the therapy that you need.
Yeah, thank you, Lupita. And in addition to what she said as well, too, we also talk about the reality of how the chemical components in our body are all connected, right? Our hearts, our mind, brain, and everything. And sometimes, even speaking with the social worker and nurses, with checking the labs, we might be able to see, is it the protein that is low? Is it something that is bringing about that low energy as well too? Because sometimes some things, it comes from there, right? It comes from being able to see what results are changing in our labs and might be affecting us physically as well.
Great. Thank you both for your responses. Lupita, this question is for you. You talked a little bit about um, how moving from in-center dialysis to home dialysis brought up some more flexibility. Could you speak a little bit more about what that some of the positives that you experienced from changing to home
Yeah.
hemo?
So the positives that I experienced, switching over to home hemo was just overall the way that I felt. When I was in center, I felt horrible, to be honest. I, had the low blood pressures, the fainting, the cramping, vomiting, headaches, infiltration, all of that. I felt it, and it just got to the point where it wasn't me. I couldn't go hiking, I couldn't go swimming because I didn't have the energy to do it. The home dialysis machine is a lighter option for my body, and it decreased those side effects. So most of the time I felt great. I had a boost of energy after my treatment. I was able to get up after treatment and do the chores that I needed to do. It also allowed me to travel. If I wanted to go anywhere, I just packed up my machine and I took it with me. I got to a point where I went camping and I did dialysis in the middle of nowhere. I did it in front of a cabin outside. So it gave me that flexibility and that freedom to do all the things that I used to like to do, and the energy.
Great. That's great to hear. Thank you. And amazing that you were able to go camping and do dialysis. I love that. All right, next question is for both of you. How can patients involve family or friends in supporting their mental health? Luckman, I'll send this to you first, and then we'll go to you, Lupita.
Lupita shared something when she was talking about the story as well too. Is that stigmatization, right? In different communities where mental health is not something that we always make talk about and share with other people. The ways that we can bring in family and friends in our care is also, creating that safe space where we can have those discussions, right? Finding that one or two people that you can trust to be able to share something with, right? So when you're beginning to identify those emotions and seeing what is happening and going on for you, being able to find someone you can talk to. I'm feeling this way today. And that way they can begin to now start giving suggestions as to, okay, do you want to talk to someone? Is there any way I can provide support for you? And sometimes that's what it is, right? When you think about therapy, sometimes you get in therapy, it's not necessarily that there's a therapeutic method being used, but sometimes it's just being able to let those words out, right? Being able to have someone to share with, someone you can trust, someone to make you feel heard. That is also very helpful.
And I'll add that some of us that are on home hemo or home dialysis, sometimes we just feel lonely. So it's not necessary for you to listen to us vent sometimes. Even just having you in the same room, sitting here without saying anything, making us feel like we're not alone physically is a help. I know, most of the time, some of us can't have that if we're solo patients, but once in a while, for a family member or a friend to come and sit with you and not say anything is perfectly fine.
Yeah, that's great advice. All right. What are some small things that can make a big difference in helping someone feel less alone while managing dialysis at home?
I'll say a simple text, how are you doing? How are you feeling? That is something small that takes you 10 seconds to type out and send, and it can make our day. just to know that somebody is interested in knowing how we feel and how we're doing.
I'll add to that as well too, and say also education about the this disease as well too, right? Going to AKF websites and being able to learn, going to the network website, learning about the disease, because that way it also helps to be able to know how to approach the person, how to understand what their experiences are, or even being able to know what dialysis is, right? So that when they're talking to you and you mention certain terms, it makes them feel heard, like, oh, you know what that is, you understand what I'm going through, even though you're not experiencing it directly, but because you care enough to be able to know what this means to me.
Great, thank you. And Lupita, I know had talked earlier about the difficulties with talking with or bringing up mental needing support. What were those initial conversations like? Did you talk to any family member about this?
So the only person that I talked to about me feeling like I needed therapy was my husband. I couldn't bring it up to my family yet, just because I didn't know what the reaction was going to be. So my husband was very supportive. He understood, and luckily, he approved and was with me on my decision to seek therapy, and was there 100% supportive. Once I brought it up to my family, I think they understood. They saw that I was going through a lot, and mentally it was being hard on me. And I think I got to the point where they saw physically that I was not okay mentally. So it was hard, but they understood.
Thanks for sharing. This question's for you, Luckman. Can social workers assist with resources like transportation or financial resources?
Yes, and that's one of the goals of our social workers, is providing all of that support. We understand that patients are overwhelmed with what's going on, and with our experience of also working with other patients and being in the field for a while, yes, we're able to assess and see what kind of resources are available to the patients. We start from even looking at the insurance, depending on the kind of insurance that the person might have. Some insurance will pay for transportation to even doctor's visits, right? So not necessarily just through the dialysis company, but it can also go to the doctor's visits, go for transplant assessments, and so many other things. And there are also certain financial resources. We can provide education and support and directions to be even able to apply for anything with Social Security, disability, and so many things like that. So yes, and there are also different resources that even AKF provides as well too. The social worker is able to help the patients navigate all of that.
That's great. Thank you for sharing that. Lupita, you talked earlier about the support group or support that you've been able to find through social media. I'd love to hear more about that. How did you initially reach out to people, and what could our listeners do to find those avenues of support?
So I actually learned from other friends that I just made on TikTok about groups on Facebook where you can just, search kidney transplant or dialysis support group, and a whole bunch of them will pop up. There's so many out there that, are so welcoming, and people share and ask questions on there all the time. And it's nice to see, that there's a community out there. So just by going on either Facebook, TikTok, and searching, dialysis support groups, it's an easy way to start that little loophole into all of the support groups online.
Awesome. That's great to hear. Luckman, I'll pass this one to you. How do you know if you need professional level support? Sometimes you may feel lonely or a little down, but how do you know if that's the level that needs professional help?
Again, the clinic social workers are always very helpful with that. So with in the clinics, especially, some of the things we do is not only do we refer out, right? We start with being able to assess to see the level of help that the individual needs. So sometimes, like this questioner said, you might just feel lonely. It might not be that you do need to speak with a professional. We might start with conversations about just using therapeutic needs, right? Therapeutic ways that we can engage with our patients, try to see how we can support them, give them certain resources, even have conversations with them whenever they make their clinic visits, or even give them a call on the phone to talk to them. And then when we see that this needs more intense therapeutic sessions, that's when we refer out.
Great. Yeah, I think if you're unsure, just talk about it and get someone else's opinion, right, to see if
Right.
more support might be warranted. All right, let's see. Next question here. It can be really hard to share that I'm struggling with my mental health. How do I overcome the stigma of mental illness and find the courage to seek out support? Lupita, I'll pass that one to you first.
So this one was something that I struggled with personally, because, like I said, mental health is not mentioned or talked about a lot in the Latin community, and it's actually frowned upon. So when I, came to the conclusion that I was not okay and that I needed help, I found that one person that I knew would not judge me, that would support me, and I spoke to him, which was my husband. From there, feeling that acceptance and feeling that support, it gave me the courage to go ahead and start therapy and slowly open that up to the rest of my family, friends, and people that I knew. It's something hard to do, but it's definitely doable.
Yeah. And something that I share with my patients sometimes as well too is, in trying to normalize mental health, I say if you needed groceries, you go to the grocery shop, you're not going to go to the pharmacy. If you have a headache, you go see a doctor. And when we think about it that way, that it's a need, if I need mental health services, I go to a mental health provider, not because it's something bad, but it's because it's what I need. When I had a headache, I went to see the doctor. When I needed groceries, I went to the grocery shop. I did not go to the pharmacy, right? So if I need mental health, then I go to the mental health provider because that's just what my body needs right now.
Yeah, that's such a great way to put it and great perspective to have. Okay, I think this might be our last question here. Can I find a therapist that is familiar with my cultural background or racial identity or speaks my language?
Absolutely. Lupita, you want to take that?
Go ahead. So yes, there's so many, specialist therapists out there. You might not find it on the first try, but you have time to continue to look for that perfect person that you have that confidence with and that understands you and your background, and you feel confident to speak to. That's what therapy is about, finding that person that understands you and that you will feel confident enough to tell your problems to and talk your problems through with them. But yes, there is a lot of therapists out there with so many different backgrounds. You just have to look for them.
Yeah, I'm talking about being able to look for them. These are the things that your social workers will help you with. The Medicare website actually has a page there where you can find providers, and it helps you filter by sexual orientation, by age, by demographics. It helps you filter and all of that. There's also a website called Psychology Today. Psychology Today also has for all states in the United States. You can filter by state. You can filter by even license if you want a licensed clinical social worker, if you want a psychiatrist, if you want an LPC, it would help you filter all of that. So yes, there are resources out there that would help you find that right person with you. And I always encourage my patients as well too. Finding a therapist sometimes is like you conducting an interview as well too. There are providers who will give you like a 15-minute free session just for you to be able to have a conversation with them to get a feeling. You go in with your questions, you ask them, try to, get a feel of this person to see if they fit into. So yes, it's fine for you to interview them just to be able to find the right fit.
Yeah, thank you both. That's great to share. Some, I think it's important to know that you don't have to go with the first person that comes up, and you should shop around and find someone that really connects with you and that you're able to open up with. That's really important. And Luckman, can you talk a little bit about telehealth for therapy? Because I know it could be hard, especially if you're trying to find someone that speaks your language or has your same cultural background, and maybe telehealth therapy can open up some more people to you.
Yes, yes, definitely. And within the social work profession, there's been advocacy towards the continuity of telehealth, mental health services. Providing therapy through Zoom or any other HIPAA protected resources to be able to. So it helps because that puts being able to find time. We understand that some of our dialysis patients are also working full time, which means that they might have limited times in the day. But imagine being able to sit in the comfort of your home to be able to talk up to a provider via Zoom on your phone, on your computer, and all of that. So yes, and fortunately enough, there are certain insurance providers that will approve for a patient to be able to see someone on Zoom.
Yeah, that's great. So if you can do your dialysis at home, you can also speak to
Do
your
therapy at
therapist
home.
at
Yes.
home. All right. Thank you so much for that engaging and informative dialogue. So we'll wrap up today's session, but before we do, I want to again encourage you to access the important mental health resources that were shared in the chat. We have lots of different links and things for you to check out there. And finally, I'd like to ask each of you, Lupita and Luckman, to share one thing you'd like our listeners to take away from today's session. So Lupita, I'll pass it to you.
I think if anything, you guys should take away that you're not alone. There's so many resources and so many opportunities out there to obtain help. You're not alone.
And I'll go with the same thing with Lupita. You're not alone, and you can do this, and your team is there to support you. Talk to your social workers, talk to dietitians, to your nurses, and your medical doctors. They're all there waiting to hear from you.
Thank you. Thank you both so much. Thank you, Lupita, for being so open and honest about the experience and your journey. And thank you, Luckman, for sharing your expertise with all of us here. We hope that our listeners found this discussion on mental health and home dialysis helpful. Don't forget to join our next session, which is Home Dialysis for All, Building Trust and Access in Underserved Communities, which will be starting at 1:45 p.m. Eastern Time right here in the same stream. And as we close out, you'll also see a quick survey in the chat pop up. So please take some time to fill it out. Your feedback is super useful as we plan future sessions like this coming forward. So thank you again, everyone, and we'll see you on the next session.